Hello students, this is Dr.NoorNigar and today we are going to discuss TEDx talk by Dr. Devi Prasad Shetty. It's not a solution if it is not affordable. Now, who is Dr. Devi Prasad Shetty? He is an Indian entrepreneur and cardiac surgeon who is also the chairman and founder of Narayan Health, a chain of 21 medical centers in India. He has performed more than 1 lakh heart operations. In 2004, he was awarded the Padma Shri, the fourth highest civilian award, followed by the Padma Bhushan in 2012. What is the theme of his talk? In his speech, he talks about making healthcare affordable for all. He also talks about alternate way of funding the healthcare, like cooperative or collaborative healthcare. He talks about women empowerment through employment. He also talks about using information technology in healthcare. Finally, he says that it is very much possible to dissociate healthcare with affluence. That is, that it's not that people who are rich can only afford good healthcare. We have to separate wealth with good healthcare. Now, what he says about himself, he says he is a cardiac surgeon by profession, but he has a very interesting job. That is to put price tag on human life. How he puts price tags on life? He says that every day he sees 60 to 80 patients, and most of them are little kids sitting on their mother's lap. After examining the child, he tells the mother that the child has a hole in the heart and he needs an operation. The first question that the mother asks him is, how much will the operation cost? He informs the mother the cost of the operation would be 80,000. So he puts 80,000 as the price tag on the child's life. If the mother can bring 80,000, the life of the child could be saved. So that is how he puts price tags on human life. Now, what he talks about cardiac surgery. He wants to make cardiac surgery affordable in India. He further goes on to say that Indians are genetically 3 times more vulnerable to heart attack. The average age of Indian patients is 45, whereas his patients in England were around 65 years old. Nowadays, he sees old father getting his young son for bypass grafting, for bypass surgery, and not young son getting his old father. Now, why do we have the largest number of young widows in the world? As he already said, most of his patients, that is Indian patients, are just aged around 45. So we need around 2 million heart operations every year. But out of these 2 million heart patients, only 120,000 heart surgeries are done. Rest 1.9 million people die due to lack of affordable healthcare. That is, they cannot pay money. They are not able to pay money for the heart surgery, and gradually they die. And when young men die, they leave behind young widows. Now, why doesn't India have affordable healthcare? That's because our government spends about just 1.1% of the GDP on healthcare, which is a very small amount considering the population of India. And this amount is slightly more than what African countries spend on their healthcare. So we cannot rely on government to provide us with good healthcare. So what is the solution? How can we get affordable healthcare? He says that we have to find alternative way of funding the healthcare. He gives an example that how they convinced the government of Karnataka to launch health care insurance for farmers called Yashashwini. Under this scheme, around 1.7 million farmers contributed just rupees 5 every month, and the government became the reinsurer. In 10 years' time, around 4.5 lakh farmers had varieties of surgeries, and around 60,000 farmers had heart operation, all because of that power of rupees 5. Now, what he's doing now is he's trying to convince the government to collect 20 rupees from mobile phone users, mobile phone subscribers. He says there are around 850 million mobile phone subscribers, and they spend at least 150 rupees per month to recharge their mobile phone for just speaking on phone. And if we collect just rupees 20 from each mobile subscriber, then we can cover the healthcare of around 850 million people. Now, if so many people have health insurance, we need to transform our hospitals, which are not equipped to deal with so many patients. And then he goes on to say how around 12 years back, they thought of building a health city in Bangalore. That is, the need of the hour, like he constructed a hospital with around 5,000 beds and facility for 10 to 12,000 outpatients, facility to see 10 to 12,000 outpatients every day. The hospital has infrastructure to conduct more than 60 surgeries per day. He says that, there is a need to construct such big hospitals in big cities to deal with the health care. When people get health insurance, many people will come forward for treatment. And for that reason, we need bigger hospitals. So in big cities, we need to build health city or big hospitals with more number of beds and more number of facilities. Whereas in small towns, there are around 100 towns in India, we cannot build such big hospitals. So we must build small super specialty hospitals with around 300 beds. And Larsen and Turbo, that is L&T, can be given the task of building these hospitals, which Narayan Hospitals, they have assigned the work to Larsen and Turbo to build hospitals in cities like Mysore and Bangalore. And L&T has been able to do it within 6 months. Now, what we actually need, he says that, in these hospitals, he involves the hospitals which he has made. In these hospitals, he wants to involve the family members in the entire process of caring in the hospital. Now, what happens? the patient comes, when the patient is in the hospital, it is the nurses who take care of him. And after 5 days, the patient is ready to go home, but the family members are not trained to take care of the patient. So what he believes, it is very important to involve the family members in the entire process of caring in the hospital. Now, they have collaborated with Stanford University and developed an audio-visual based curriculum to train the spouse. Like if the husband is in the hospital, the wife is trained through this audio-visual based curriculum how to take care of the husband when he comes home after the heart surgery. Now, then he goes on to speak that if we want to create a stable society, if we want a better future for our country, we must create jobs for rural women. Now, why is it important to give jobs to women? So he prefers giving job to women than to men. At one point of time, his hospitals had over 90% employees as women. Now he says, if you have a job and you give it to a man and you give him a salary of 6,000 rupees, he will spend 3,000 on himself and he will give to his family only 3,000. But if you hire a woman, if you give a job to a woman, she would spend her entire salary on the family's welfare. Moreover, when women from lower socioeconomic stratum, when they are employed, they become empowered. And these empowered women can discipline their children. And these disciplined children, when they grow up, they build a great nation. Now, the next big thing that is going to happen in India, especially in the Indian healthcare, is the use of IT to make hospitals safe for the patients. Now, he then goes on to say that American hospitals, which are considered as one of the safest hospitals in the world, are not actually safe. He says getting admitted to the American hospitals is 10 times riskier than skydiving. So now, how to make hospitals safe? He gives 3 suggestions, 3 solutions. First, to use information technology. We can replace charts, manual charts, with iPad-based solution, which will follow the patients. Next, we can develop simulators to train critical care nurses, that is, nurses who are appointed in the ICU to take care of the critical patients. These nurses, instead of making them, instead of training them with actual patients and risking their lives of these patients, these nurses can be trained through simulators. And Narayan Rudalaya is spending a huge amount of money in developing these technology, these simulators. He says, if we can train a pilot to fly F-16 fighter plane with the simulators, why can't we use simulators to train critical care nurses? Now, how do we bring down the cost? As he said in the beginning, if a solution is not affordable, it is not a solution at all. So the main point is to bring down the cost. How can one bring down the cost? He gives example of his own hospital. In his hospital, they don't check profit and loss account after the end of the month. They don't do that. They check it on a daily basis. the doctors, the administrators, every day get the list of expenditure and the debt they have every day, so that they know, how can they save money? How can they reduce the cost? And if they check the balance sheet at the end of the month, it would be like examining a post-mortem report. Nothing can be done to retrieve the patient. So it is important that the profit and loss account must be dealt with on a day-to-day basis, on a daily basis. And that should work as a diagnostic tool to reduce the cost. Now, he says because of these innovative ideas, his organization was profiled at the Harvard Business School as one of the case studies. Also, the story of Narayan Hrudalaya was also, published in the front page of the Wall Street Journal. That is a very famous newspaper in America. That newspaper had covered the story of Mr. Devi Shetty in the front page. Now, what he believes that India will become the first country in the world to separate healthcare from, wealth. Wealth should have nothing to do with quality healthcare. They should be separate. It's not like people who are rich can only afford good healthcare. No, he wants to separate these two in India. And also, he wants to say that India will prove to the world that the wealth of the nation has nothing to do with quality of healthcare its citizens can enjoy. That means it's not like only rich nations can provide quality healthcare to its citizen. Wealth of a nation has nothing to do with quality of healthcare that the citizen of a country can enjoy. He wants to prove to the world that India can do it. India can separate wealth from good healthcare. India can separate, wealth of the nation has nothing to do with quality healthcare. How can we do it when there are so many developed countries who have not been able to provide quality healthcare, affordable healthcare to its citizens? How can we do it? He says we can very much do it because we produced the largest numbers of doctors, nurses, and medical technicians in the world. And outside the US, we have the largest number of US FDA-approved drug manufacturing units. We have so many drug medicine manufacturing units. We produce the largest numbers of doctors, nurses. Why can't we make our healthcare affordable for our citizens? Why can't India become a nation, first nation in the world where the wealth of the nation has nothing to do with its healthcare? Finally, he concludes his speech by saying that we Indians do not give credit of any good work to the policymakers who make things happen. We don't acknowledge the effort, the work of all policymakers. We Indians believe that everything good that happens in this country, it happens by chance, it happens by default. So there he says that there is one country in the world that is directly managed by God, and that is his country, India. With these words, he concludes his speech. Thank you very much.